Okay. Okay, so last video, first part left off at the abdomen. Kind of ran out of space on my memory card, but cleared it now. So now what I'm going to do is inspect the patient's abdomen first. I'm going to notice that the contour is flat. There are no obvious scars or lesions or rashes. I don't see any pulsation in the abdomen. I notice that the skin color is a little bit lighter than the rest of his skin color. That's normal because it doesn't usually get as much sunlight. And now what I'm going to do is auscultate all 4 quadrants for bowel sounds, as well as for bruits after that with the diaphragm. Okay, and bowel sounds were present in all 4 quadrants. I'm going to use the bell to auscultate for bruits. I forgot to do them with carotids earlier, so I'm going to assess those as well. I'm just going to have to take a deep breath in and hold. Okay, relax. No bruit was heard in the right carotid, and inhale and hold. Okay, no bruit was heard in the left carotid either. Now I'm going to assess bruits in the abdomen, in the aorta. Now I'm in the right renal and the left renal, right common iliac, the left common iliac, and then right femoral and left femoral. And I did not hear any bruits. So now I'm going to go on to light palpation of the abdomen. I'm just going to have you put your feet up on the table just a hair, just to relax the abdomen, flatten it out. I'll lightly palpate here, assessing for any kind of rigidity or guarding, muscle guarding, and also just looking to make sure he's not grimacing in any way, make sure nothing is tender to the patient. Now I'm going to go ahead and do a little bit deeper palpation, and what I'm assessing for here are any masses, abdominal masses, or tenderness as well. And didn't feel any masses or nothing was tender to the patient. As you can see, he's calm. So now from here, what I'm going to go ahead and do is assess his lower extremities. As you can see, he's got just a little scab here and there, nothing major. Hair distribution seems even and normal on both legs. Now what I'm going to do is just passively check his range of motion in his right lower extremity. Extension and flexion are normal. I'm going to have the patient just press his leg against my hand, good, and strength in the right knee and quad was, I'd give it a +5 out of 5. I'm going to assess for range of motion in the right foot, and this seems about +5, it's good. And now I want you to press your foot down against my hand, alright, and I'd give his strength in the foot +5 as well, out of 5. I'm going to check range of motion in the left leg, and extension and flexion seem normal. I didn't feel any crepitus in this knee, and I didn't feel any crepitus in this knee. It doesn't seem like anything is tender to the patient. So range of motion was good, and +5 in the left. Now I want him to extend his leg against my hand, good. And that strength is +5. I'm going to check range of motion in his foot, and that seems +5. Now I want him to push your foot down against my hand, good. Strength in the foot was +5. I'm going to go ahead and have you extend your feet up. You're pushing against my hand, good. And here, good. Now what I'm going to do is feel the dorsalis pedis. So you can put your feet up here again. And those are right here between the first and second rays, or metatarsals. And they appear bilateral and symmetric and regular. And I'm going to give his dorsalis pedis pulse +2. And now, from here, I'm going to have the patient stand up and do Romberg's test. So go ahead and face me, feet together and eyes closed. And the other thing I'm observing for is the patient to sway either back and forth or side to side. And if he does not do either one of these two things, it'd be a normal test. And of course, it's testing cerebellar function and balance coordination. And I believe that is it. Thanks.